So, hi Selena.
Hi.
How was your weekend?
It was good.
Mm-hmm.
I went to New Hampshire with my husband to have a brief trip. It was nice.
Mm. So, what do you guys do?
Actually, just go there, relax.
Mm-hmm.
We didn't do like much.
So, it sounds like it's pretty nice for you to,
Mm.
take a escape from the city.
Yes, I love the air. Recently the pollution here is like
Right.
crazy.
Mm.
I think like have a brief trip to the forest is quite good.
Yeah. Oh, and speaking of that, so how are you feeling today, actually?
Mm, quite good. Mm-hmm.
Oh, and you know, I know the travel could be like kind of exciting for you. Have you been keeping up with your medications?
Yeah, I almost forgot it,
Oh.
to be honest. Like, before we go, my
Mhm.
husband reminded me, did you take your medication? I was like, oh God, I forgot it. But like, I took it like after he reminding me. But yeah, I took it every day.
Mm. I'm glad that you took it, and your. It seems like your husband is being very supportive.
Yes, I agree. He always like remind me before I sleep. So yeah, I'm glad that he's the one like always being so supportive and reminding me to take medication or like encouraging me to stay abstinent. So that's a great supportive partner.
And you have you encountered any difficulties of remembering to take the medication during the week?
Mm, of course, like I don't know, it may be the side effect of the medication. Sometimes I feel a little bit like dizzy or a little bit like muscle pain. So I don't know whether it is like consciously not do not want to take it. So sometimes I forgot it before sleep. I usually take it before sleep, and sometimes I just forgot it. And usually it's my husband who remind me to take it. But there's times when he was super busy, he cannot go back home before I sleep, so I just go to sleep without taking it. But that was really seldom, so not many days.
Okay. Is it like do you mean that your husband are suddenly super busy, or do you mean that you suddenly forgot, even if your husband is like busy? It's not there to remind you.
I usually can take it by myself, just like 1 or 2 days.
Oh.
In the past like month, I forgot to take it because he was also busy. So yeah.
So, what do you think, like, you did right so that you can remember to take the medication?
You mean the days I did remember to take it? Okay, so I think, um, oh yeah, I usually just put the medication near my bed, so every time I go to bed, I can see it. I can remind myself, okay, it's time to take medication. I didn't take it for the day, so now it's the time to take it. So I think that's one of the like strategy I use to take it.
I agree. I think that's a very nice strategy that you have here. So I would encourage you to keep doing it. And it seems like it's really been working for you. And I actually, I have your math results, your UA urinal analysis results here, and it seems that it's positive. So yeah, you're taking your
Yeah, I take every
medications
day
daily and
for the
on time.
past
Yeah.
week. Yeah.
Yeah, I'm super glad that you're being very consistent with this, and taking medications can be very important for you to stay abstinent, and it can make the process easier.
Okay.
Okay, and so I also have your urinal analysis for your your drug test and it's negative.
Yeah, I didn't take any drug for a month already.
Oh yeah, that's. I mean, I can't imagine that. Can be challenging.
It is.
Especially for the first month.
Yeah, especially at the beginning of it, I got quite like struggling with the withdrawal effect. I was super dizzy at the beginning. I feel like really, really anxious. I think I was anxious for like, what if I relapse? This could do really bad to my baby. And I was really anxious for that, and also I feel anxious for not taking it. I really want it. It's like it's like an instinct. I just want it. But yeah, I think nowadays it has been a month. Things are getting better. I don't know whether this is medication or something like that. I feel like less craving for using, so I guess it's better.
Yeah, I mean, it's very common that you feel like that kind of side effects or withdrawal effects from not using heroin, and it's also very common for you to feel those cravings where you thoughts of keep thinking about like taking it or not taking it, the pros and cons of taking it, and in the fact that you've been using it for, wait, correct me if I'm wrong, I remember it's like 8 years.
Yes, 8 years.
Yeah, it's a very long time. So and you said you it almost feels like an instinct for you.
Yes.
Yeah. So and you can imagine that it would take a long process to make that effect like finally like taper off. Oh, and actually, when you said you had like dizziness, is there other symptoms that you were feeling?
You mean symptoms
Like,
related to the drug or the medication?
Yeah, like any of that.
I feel like vomiting. Yeah, sometimes.
So dizziness, vomiting, sometimes.
Yeah.
Anything else?
Like nauseous a little bit, and sometimes for fatigue. Yeah.
Well, those certain could be, withdrawal effect. But I was actually wondering if since you're pregnant right now and you're also taking buprenorphine, it could also be some, effects related to those, the fact that you're pregnant or the medications. So have you been, meeting with Dr. Smith recently?
Yes, I met him. He did mention that the medication for drugs could result in some maybe side effects for like feeling anxious, muscle pain, feeling of dizziness, things like that. And he really recommended me to talk more about some other symptoms with my doctor in the hospital.
Gynecologist.
Yeah, and the doctor told me that the vomiting is quite normal. It's not related to like any negative implications of my baby. So I got quite relaxed, like such a relief for knowing that. I was quite anxious about like how the medication is going to influence my baby, or did my past experiences of like drug using could influence the health of my baby. So yeah, I think talking with them or like making me more relaxed, calm down, things like that.
I'm glad that you keep coming to the counseling session and meeting with your gynecologist and Dr. Smith. And so in the future, if you ever encounter similar symptoms, or if those symptoms got worse, you can always talk to us. Ask if maybe Dr. Smith and your gynecologist, if it's things related to pregnancy and medications, we can always adjust how you would take it, the dosage and the time and frequency. And so, as we talked about in the past few weeks, we have this incentive programs keep going, and so today your drug and your MAD urinal analysis results show that you're meeting those criteria, and I'm also super glad that you came here today. So that means that you have 3 chances getting draws from this valve here.
Yes.
Okay. Okay. How does that sound?
Sounds good.
Okay.
Okay, let me see. Oh, this is nice for keeping up.
Oh.
Okay.
Okay. Well, you still have 2 chances.
Okay. Oh, it says like two $20 voucher.
Oh yeah, so that's actually a large prize for you.
Okay.
Yeah.
Sounds
so
good.
you can actually use this voucher at the grocery store down the street.
Oh, sounds good.
They have many options. And
Okay.
the final chance.
It says a small prize. What is that?
Well, do you remember 2 weeks ago you also get a small prize, but
Yeah, what's a toothbrush?
yeah, but this time, of course, you can choose other. We have a list of items,
Okay.
and like lip balm, toothbrush is definitely one of them. Like hand soap, and something, maybe even something that can help you in the long term with babies.
Okay.
Yeah. So yeah, and I can take you to the front desk.
Okay.
Like,
Sounds good.
for you to choose from a list.